You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the role of a pharmacist and how it has changed. Many experts believe and agree that pharmacists have been underutilized. With us, we have clinical compounding pharmacist, Mort Farina. Mort, welcome to the program.
Nice to be here.
Now, we've had you on the show, I think like 13 years ago. Long time, like at the very beginning of the Wellness Hour. And for people that don't know you, because I always think everybody in the Coachella Valley knows you, right? Tell us about, what you do. Because I know you, as a compounding pharmacist, you make things. You make hormones. You put things together. But you do more than that, so tell us.
Over the years, we've custom made thousands of different medications that are not available by drug companies.
Okay.
We don't make prescriptions if it's available by a drug company. We're not allowed to make it. So we only can make medications that are not available. Okay. So when I had a patient came into the pharmacy the other day with an eye infection, and every medication the eye doctor tried on the patient did not work, and he was basically blind. The doctor came up with a very high potency eye drop, antibiotic eye drop, and it fixes his eye immediately.
And then you just put it together. You make it.
We just make it. We make that in what's called a sterile environment. We have an IV hood, and we have a pharmacist that's trained, hospital-trained pharmacist who's worked 20 years in hospital pharmacy, and she can make anything any doctor thinks of.
And in your practice as well, I mean, you have things like bone density testing available, clinical nutrition. I'll let you tell me. What are the different services you offer, I should say?
Our pharmacy is actually different than any other pharmacy that I am aware of in the country. Okay. And I've trained thousands of pharmacists over the years and pharmacy students. Most of them listen and are really excited to hear what I say, but it's a lot of work to do what we do and to maintain your education level. Okay. So you can continue to talk to patients and fix them, help fix them, and communicate with the doctors. And that's all starting to change. Okay. Now, what's
the recent, you were saying that the pharmacist's role now has even changed, where you can go to a pharmacist, and correct me if I'm wrong, the new laws or the new regulations or whatever they're called, that insurance now will reimburse a pharmacist to take a look at all the medications you're on. Is that right?
Well, it's even more than that. Right now there's a huge shortage of general physicians, primary care doctors. I think there's about 40,000 doctors alone retiring in the United States this year alone. Okay. Yet they don't have there's very few new medical schools, and most of the doctors I know don't want to go into primary care. They like to go into the specialties. So somebody has to take care of those patients. So that's why they've been building nurse practitioner schools and schools for physician's assistants and naturopathic physicians. In pharmacy, a couple of years ago, there were 3 pharmacy schools in California. Now there's about 15.
15. So healthcare is changing, and you're one of these guys that's really on top of that. Okay. So now there's going to be millions of people that have access to medical care. Is that one of the reasons why in fact, there's even rumors that pharmacists are going to have prescriptive authority? Well, is that right? I mean, is that true?
Well, those rules are being written as we talk. Okay. And they're being done all over the world, so this is not new. Okay. Pharmacists, by far, the most underutilized professionals out there. So you have with Obamacare, or whatever you want to call it, the new insurance is going to be somewhere between 20 and 60 million new people qualified for health care. So, and there's a lot of problems with the existing healthcare system. So
which is another topic, obviously.
Well, the first thing we have to do is fix the old system and then prepare to implement the new programs. And part of that implementation will be the pharmacist's role.
Using pharmacists.
Using pharmacists.
So right now, I mean, in your pharmacy right now, insurance companies, if you have insurance, will pay for a consult with you or one of the many pharmacists you have there. Is that correct? Do I have that right?
The insurance companies are going to select patients that they think need help in their medications. They're going to the doctors too often. They're getting too many medications, getting hospitalized, they're not complying with the medications. So these patients will be put on a list, and that list will be made available to the pharmacists, who will then contact the patients, and those patients will come to the pharmacy for the consultation. And this consultation will take between a half hour and an hour. And that consultation, from what I understand, and I've gone to all the meetings and I've taken the classes, that consultation usually takes about an hour.
About an hour. Because doctors, I mean, look, traditional doctors, mainstream medicine, I mean, they have a lot of things. It's tough for them to take a look at every one of the medications of a patient and give their evaluation. Is that correct? Is this a relief on them, or is this going to make it worse on them? Are they going to say, oh no, now you've got a pharmacist giving their opinion?
Well, the biggest problem that doctors have, they don't have that much time to spend with each patient.
Okay.
And doctors are reluctant to take a patient off a medication that another doctor had put them on. So patients get put on a medication, and 10 years later they're still taking the prescription, even though nobody remembers what they were given it, why they were taking it.
Okay. So for liability reasons, you get on a medication, you stay on it.
That's right.
So we talked about this briefly over the telephone, because I knew you were coming here. And you said, and I was thinking, this may be a good way where a doctor can, you know, on this new program where you can look at all the medications, make recommendations, they don't need this, 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 and this. Now they're in less of a liability situation to get them off of it.
Well,
is that correct?
The consultation, when the pharmacist completes it, he gives one sheet of notes to the patient, suggestions on maybe taking their drugs correctly or whatever the problems they identify, the simple problems. And then on the second sheet goes to the physician's office. And the physician's office then can make the changes that are required. That same sheet that goes to the physician's also goes to the insurance company. So they have a record of it.
So this will allow doctors then to better take people off certain medications, because now they have a second opinion. You know, the pharmacist said it was okay to take them off this, this, and this.
Well, it could be, but a lot of the patients, a lot of the medications cause side effects. And the biggest problem I have, a lot of times, patient has a side effect, and then all of a sudden the patient's being treated for that side effect. So if, like the average psychotropic drug, 86% of people that take psychotropic drugs have one or more side effects.
Okay.
56% of patients that take the drugs for lowering cholesterol have one or more side effects. So if you're having aches and pains from the cholesterol lowering drug or loss of memory, and it's identified that it might be from the medication, sometimes you have to eliminate the medication and use a different medical approach to treat the patient's problems.
Okay. Now, even though this is somewhat new, some of these regulations where pharmacists will now be involved in doing these consults, you've been doing this, I guess at least since I met you about 13 years ago, right?
I've been doing it.
You've always done this.
I've always done it. And the Kaiser hospitals in California alone have 500 pharmacists doing nothing but what we're talking about. They wouldn't be spending that money on pharmacists if it wasn't cost effective in helping their patients.
Okay. And in your, I mean, okay, so people need to know, if they want a review of their medications, they're on 8, 12, you say some people are on 12 medications. I didn't even know that.
Some 20.
Okay, so they're on 12, 20, whatever medications. They could go into your pharmacy, you're in Palm Desert, and their insurance may give a small reimbursement to you to look at those, and then you'll write up an evaluation to give to their doctor. Is that correct? Do I understand that correctly?
That's one of the approaches.
But that's one of the things you offer right now.
That's one thing, that's correct.
Okay. And then, in addition to that, we should mention, because you've been doing this a long time, and people need to know it's a real interview, that I'm not endorsing Mort Farina here, but you say you see reversals because you believe in nutrition. There's like nutrition, you believe in nutritional supplementation, the right kind of exercise,
hormones,
and optimizing hormones. Is that right?
Precisely.
Okay. But you see reversals where people that have, you know, we were playing a game before the cameras were on. I said, okay, let's talk about some diseases where you haven't seen reversed. And I named off all the common ones, and you said yes, 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 yes. So you see people getting better all the time.
It's absolutely amazing. For me, it's very uncomplicated. Ron Partain and Steve Pomerantz, these are two other pharmacists that work in my pharmacy. Ron is also a certified clinical nutritionist. We also have 2 nurse practitioners that work in my pharmacy, Janet Miller and my wife, Leslie Todd. And they're all phenomenal, and there's no pressure put on them to sell things, to spend very little time. They don't have the time constraints. And that's just the way I set up the pharmacy. I did it because I could.
Okay. I mean, you're a major compounding pharmacy. Do you ship all around the country?
We're not a mail order pharmacy, but if one of our patients gets a prescription in our pharmacy, we'll ship it anywhere.
Okay.
But we don't work with doctors who are, let's say, out of state. We make, like the injectables that we make for our patients, we work with the doctors in the community. They write the prescriptions. We make the prescription. We dispense the prescription, then we go over it with the patient.
And I try not, we're in San Diego and I'm so busy, our show airs all over the US and Canada, but they'll say Mort is like this or Mort's like that, and I say, well, pretty much Mort's telling people just to eat good food. I mean, that's your main thing, is to eat clean. And the only thing that separates you, maybe even that may be controversial, is optimizing hormones.
Well,
right?
Dr. Henry Bieler, who wrote a book, Food is Your Best Medicine, in 1966, was the first book that I've read that really influenced me. In fact, my niece, who had leukemia, was going to medical school at Harvard. I kind of tracked him down. He was 89 years old at the time. He said he wasn't seeing any new patients. I talked him into seeing my niece. I flew her in she lived in Chicago. He put her on a diet, and 6 weeks later she went back to Boston, and they couldn't find the leukemia. It was gone. In her case, he says she just could not have any dairy. So when all of a sudden, that woke me up. That's what really started, that's really what woke me up.
Is that right?
Henry Bieler. So when I see Food is Your Best Medicine, then on Dr. Hyman's lecture, he has a big sign that says, Food is Your Best Medicine. And I asked him if he ever heard of Henry Bieler. He said, who's Henry Bieler? So there have been physicians who've been saying these things years and years and years, but very few people have listened to them. And I think that's mainly the influence of Big Pharma, the drug companies. And now people are smarter. You have a patient comes into the pharmacy who's under 50. I mean, they came back from the doctor, and the doctor gave them a diagnosis. They went home and checked that diagnosis on the computer, and they know a lot about that disease. They know the symptoms, they know the treatments, okay? And I think that's wonderful.
Okay, for people that are just tuning in, we're talking about how pharmacists may be underutilized. They go through 8 years plus worth of schooling, but a new law, is it a law that's passed? Or, yeah, a new law just passed where a pharmacist now, you can take your list of medications to your pharmacist. Of course, that has to be certified or have gone to special training. Not a lot that have gone through this to fit.
Not yet.
Not yet, but you can do it now?
Yes.
At your pharmacy, your people have been through that training.
Right.
And they can show you this, and then you'll get some reimbursement from their insurance company.
Yeah, the reimbursement comes right from the insurance company.
Okay.
The patient doesn't have to pay for that.
And then
service.
that you give to the doctor.
The doctor
and,
gets.
and you'll also have access to their medical records?
Well, to the lab work and things like that, yeah, absolutely.
Okay, good.
Because the pharmacist wants to do a complete consultation. And the more information we have, the more complete our consultation could be.
You say they do this in other countries right now.
The pharmacist's role in other countries is just absolutely amazing. You know, the United States, we're rated so low in quality of health care. Infant mortality, 42nd. Quality of health care, 48th. I mean, this is nuts. Education, 24th in education. That's crazy. We used to be #1. Finland is #1.
Okay, but keeping it back to the pharmacy, you're saying that they're utilizing pharmacists in other countries
Absolutely.
for managing medications, things like that.
Absolutely.
Is that right? Why did it take so long here to finally do this? Because of the new health care?
Well, they all have some kind of managed care system. We're probably the only civilized country that does not have some kind of managed health care.
Okay.
Or socialized health care. I don't know what you want to call it. And I have one of my clients went to France, was hospitalized, was in the hospital for a full week. She got complete treatment. When she left the hospital, her bill was 0.
Okay.
Nothing, because the medical care is covered in France. So the role of the pharmacist is not so much how many prescriptions can you fill, it's what can you do to help the patient get better.
And tell me this, okay, because I talked to, after I spoke to you on the phone, where pharmacists today in the U.S. make it prescriptive authority. That's what it's moving toward. And right now, a patient could go in there and the pharmacist will get reimbursed. So I guess all of the chains across the country will probably have these little day clinics where a pharmacist will do these evaluations, bill the insurance. So you're going to see a lot of that going on probably.
Well, a lot of it's being done now with the immunizations.
Okay.
Almost all the chains are now offering the immunizations. They're setting up little areas.
So it's been expanded of what the pharmacist can do. Is that right?
Right, correct.
Okay. And then, but I talked to a medical doctor who works here in San Diego at one of the major, and she says, well, that could be a problem. It could be a good thing because it'll give me relief when somebody's on 15 medications. She goes, I don't have more than 10 minutes to spend with a patient. But it could be a bad thing where I'm sending a new patient, new prescription, and the pharmacist is putting their nose in it where they shouldn't. Well, so what's your response to that?
Well, one of the things about when a patient will come into our pharmacy, they may be going to 5 or 6 different pharmacies and using mail order pharmacy, so they're getting prescriptions from all over the place. So, and they may be going to 2 or 3 different doctors. So the doctor doesn't know all the medications the patient's on. The pharmacist doesn't know all the medications they're on. So a lot of these medications have side effects, very serious side effects. So all of a sudden, if you're treating the side effects and the doctor doesn't know or the pharmacist is not aware that you're on the drug, that creates a big problem. Okay. And that's what this will address.
Okay, good. So you think people will get healthier, be a lot of prevention?
Well, we'll get all the drugs the patient's on from the insurance company. Because if they're using the insurance company and 5 different doctors, we'll still get all the medications, we'll get the lab work, all that's going to be available to the pharmacist. Not only my pharmacy, but all the chains and all the pharmacists that are willing to do it.
Well, it seems like physicians would love this. Some of them.
I'm
saying some of them. Do you think some of them will love this? It will save them some time?
I think that when it becomes standard of care, and most pharmacists are doing it, and doctors are getting these faxes or emails from the pharmacist, and they're reading it, and then they have the patient there, and they realize what the pharmacists are capable of doing, then everything will change. But right now, there's so few pharmacists really talking to patients. They don't have the time.
It's a shame. Pharmacists, I was talking to somebody that works for one of those chains, and I have a good friend that's a pharmacist, and they said they didn't sign up for this. They're just like a clerk dispensing things. And now this will allow pharmacists to utilize their education. Is that true?
Absolutely. In fact,
I'm not trying to side with you on this, but it seems like
they're
totally unutilized with all this education.
Also, you got these pharmacists graduating school now that have 8 to 10 years of college training. These are some of the smartest kids in the world. Most of them have straight A's.
Okay.
And the students are amazing. And so it's not like you're taking a pharmacy technician. You can become a pharmacy technician in a very short time, in a couple of months. To become a pharmacist, you're talking about 8 to 10 years.
Okay.
That's a lot of information. You should be doing more than just supervising the filling of prescriptions.
Okay. So that's something you offer right now at your pharmacy. We're almost out of time. Time flew by. When you drove here, I'm sure there's things that you wanted to talk about. So use your pharmacist more. The rules have changed. I know you're a big fan of bioidentical hormones when necessary.
The other thing,
what else did you want to talk about?
Dr. Shenya, who discovered the Shenya technique, which is the colonoscope, and help affect the colonoscopy, he taught at Albert Einstein Medical School for over 50 years, head of endoscopy at Bethesda Hospital. In his book, The Enzyme Factor, he says you can cure most diseases, including cancer, by doing 3 things. Exercise, and you don't have to run like a lunatic. You just do Tai Chi or stretching. Eat right, so your bodies can make the enzymes that the body needs. And he basically talks about no sugar, no bread, nothing white. And then he talks about drinking good water.
You're a big fan of this water. We have a few minutes for this water. Is it Kangen water? What is the name of it?
Kangen water is just
like alkalinizing water.
That just means return to good health.
Okay.
What it is it's ionized alkaline water. So the water comes from the faucet, goes through a filtration system, then it goes through an ionization system where it goes over plates made of pure pharmaceutical grade platinum and pure pharmaceutical grade titanium, and it becomes charged and it becomes very small size, microclustered it's called. So when you drink the water, it doesn't go into your stomach, it goes right through your esophagus.
That's hard to believe. So I told you, I drank some of your water there. And I didn't sleep the night before. I felt better, but I didn't know if it was a placebo effect or not, because I'm very skeptical about this water. But you say, and you drink a bunch of water as fast as you can, you could feel it jiggling in your stomach. This stuff goes right into your tissues.
Well, unless you're drinking it right with your food. Because there's something called the pyloric valve, which keeps the water from going into your stomach.
But if you drink it on an empty stomach?
If you drink it on an empty stomach, it goes right into your pores, your skin, flushes out toxins. That's how it gets rid of inflammation, arthritis, and things like that.
So it goes into the brain?
The brain, the tissues, everywhere. And somebody who has heartburn is because the gastric juices and the enzymes are coming from the stomach up through the pyloric valve to the esophagus, causing burning. Well, if you're drinking this very small clustered water that's alkaline, and it goes right through your esophagus, it stops the heartburn almost immediately.
Have you had that in your?
Oh, about 1,000 times. I mean, this is.
You love this water.
It's so no. The science is there, and the Japanese. Just about everybody in Japan drinks that water. Just about the whole Japanese.
You know, I read this report. I didn't understand what he was talking about. It's pretty scientific. I guess you almost have to be like a chemist or something to understand what it was saying. It's a couple of Nobel Peace Prize guys are involved in this company. Is that right?
Well, the medical directors, one of them is a physician who developed a stent for the heart, teaches at Harvard. The other was Dr. Shenya, who taught at Albert Einstein Medical School, who now retired, and he's back in Japan. So the science goes back about 40 years ago. This is not new information.
And these machines, I mean, are like $4,000.
Well, they go from about $1,200 up to $6,000.
Now you give away like 100 gallons a month or something?
About 500 gallons a day.
A day? Oh, sorry.
A day. Patients come in with their bottles, and patients who have cancer and certain diseases, we have no limitations on how long we'll give them the water.
So with this water, and I want people clear, I'm not endorsing it, but you believe, I mean, you're convinced, we've talked in the green room, that this water combined with nutrition, this water combined with bioidentical hormones when necessary or indicated,
certain vitamins,
minerals, that you see reversals. In fact, you even said one of the guys, in fact, I dropped by your pharmacy, I haven't been to your pharmacy in a long time, and one of the guys there, a surgery was canceled, and he gave the water the credit.
Yeah, well,
I mean, that's true, isn't it?
Absolutely.
Okay.
That was 3 years ago. He was supposed to be dead in 6 months if he didn't have the surgery. And 3 years ago, now at 79, he feels better than he's ever felt in his whole entire life.
Okay, so if somebody's watching this, they want to know more about the water, they can visit your pharmacy. If they want to know more about hormones, you guys offer consultations. If you're on 8, 10, 12, 20 medications, and if you have insurance, what about Medicare? Is that going to reimburse the pharmacy?
Absolutely. Medicare,
so if you're on Medicare?
Medicare Part D reimburses.
So kids that are watching...
By the way, it's a direct reimbursement from the insurance company. The patient doesn't have to pay anything.
Well, this is interesting. Okay, so kids that watch this show, okay, let's say 40s, 50s, your parents are in a nursing home or whatever, and they're on a... It's very confusing. My mother's in a nursing home of all the medications they're on. So now, if you're watching this, you're saying that they could bring in their parents, or one of them, they have Medicare, to go in, you could meet with them, you're covered by insurance, to give an evaluation that'll be written up, given to their doctor. Is that correct?
That's correct.
I have it right.
But there is a law that requires every patient in every nursing home to have a pharmacist do a drug regimen review every single month. That's a law that's been in effect since the 1970s. I know because I'm responsible.
So that's already being done?
It's being done by pharmacists. It used to be paid for by the nursing home. Now they've bypassed that and it's being paid directly by the insurance company or the government. Okay, because they realize the role of the pharmacist in cutting back medication is absolutely incredible, incredibly successful.
So now You've been fighting this fight to say, hey, let pharmacists return back to what they used to do in the old days. I guess you had a cold in the 30s or 40s or 50s, apparently. You would go to sometimes you'd go to your pharmacist. Is that right?
Most people still do, and especially outside the United States for certain.
So when I met you 13 years ago, you go, Randy, you know, at my pharmacy, this was 13 years ago, you say, we're doing what pharmacists used to do. Is that right? Well, and now you're getting paid for it with insurance. Insurance now will allow you guys to look at medications, give recommendations. Is that right?
And write up a complete consult. And the other thing is that you have to remember, when patients come to pharmacists, years ago, most pharmacists were compounding pharmacists. When I worked in high school for 4 years in a pharmacy, I worked in a compounding pharmacy where we custom-made prescriptions.
Now, by the way, we are completely out of time. Final message, somebody watching this. They want advice on all the medications they're on. What's their first move, first step?
I think that Town Center Compounding Pharmacy is probably the best pharmacy in the country.
Is that right?
Because we got the people there who have the knowledge, and there's no other agenda but trying to help people get better. We work with the patients, we work with their physicians, and try to give them information to educate them. So if they have a problem, we can maybe give them suggestions that their doctor or they have not been aware of before.
And you'll work with their doctor?
We work with their doctors, and we do a lot of referrals.
Okay, good. Well, thank you, Mort. It's always a pleasure to have you on the show. Very
welcome.
Interesting. Good work. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again, you just caught part of it, and you want to see the whole thing, go to wellnesshour.com and just put in Mort or Mort Farina, and you'll find him there, or Compounding Pharmacy. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.